Hi, this is video number 3 concerning urinary tract infections. Acute pyelonephritis or acute kidney infection indicates that the urinary tract infection has traveled upward from the bladder to the kidneys. The symptoms can include fever, pain in the area in which the lower rib cage attaches to the vertebrae of the spine. It's called the costo-vertebral angle. Abdominal pain, as well as the symptoms of urinary frequency, urinary urgency, and pain on urination, normally associated with an uncomplicated urinary tract infection. These infections, if not severe, can be treated with oral antibiotics, as outlined in the previous video. But if the infection is severe and a blood infection is also suspected, the patient should be admitted to a hospital for initial treatment with intravenous antibiotics. The initial treatment can then be followed by a continuation of oral antibiotics. Urinary tract infections in infants and young children under the age of 2 years can be difficult to diagnose due to their inability to articulate symptoms. Symptoms such as fever, vomiting, diarrhea, and failure to thrive may indicate a urinary tract infection in these children and must be considered when evaluating these children. As a child becomes older, he or she can indicate the presence of pain on urination and/or urinary frequency. In these children, the symptoms require further examination to determine if anatomical abnormalities exist. Urinary infections in the elderly must be treated quickly to ensure that further complications do not occur. This is particularly true for individuals who are immobilized, have fecal incontinence, or compromised bladder emptying. Sometimes an individual can have an asymptomatic urinary tract infection. He or she can have an infection, but do not show the classic symptoms of a urinary tract infection. In men, this must be treated and investigated. There may be a chronic prostate infection. In neonates and young children, treatment and further investigation for anatomical abnormalities must be done. Pregnant women should be monitored for the occurrence of an asymptomatic urinary tract infection to ensure that a urinary tract infection does not develop into a complicated infection. When to refer is an important issue. If there is a urinary tract abnormality, a referral to a urologist or nephrologist should be done. If a patient's renal function is impaired, referral is necessary. Men with recurrent urinary tract infections must be referred to a urologist. Persistent blood in the urine requires a referral. So if you think you need a referral, make sure your physician gives you one. Well, I hope this helps. Have a good day.